We heard many times today that sales and marketing is changing in our industry. I would like to suggest that everything is changing in our industry, from pricing to reimbursement to insurance to everything, package design, no stone unturned. But I think one area for sure is CHE. Inducted into this year's Hall of Fame would be Kathryn Raymond, the retired Director of Healthcare Education from Purdue, and to present to her, Susan Chalmers, Manager of Healthcare Education, Purdue Pharma.
I just wanted to say congratulations to all of the inductees, and to Jonathan, thank you very much for getting emotional, because I was terrified that I was going to be the only one, because I know for sure I will. I'm so honored to have this opportunity to introduce Kathryn Raymond to you as she's inducted into the Hall of Fame, and to celebrate her very distinguished and successful career. I've had the great pleasure of working with Kathryn since 2000. And in those 14 years, we've shared many successes, milestones, and lots of fun times. I'm pretty sure that Kathryn was the model used for the development of the Purdue Pharma corporate values: integrity, respect, innovation, and accountability. These 4 values describe Kathryn perfectly. As evidence of this, I'm going to do things a little bit differently. Several of Kathryn's colleagues, CME colleagues from industry and academia, have sent me messages, and I'm going to read a few of them to you. So from Dr. Bernard Marlowe, past Director of Continuing Professional Development at the College of Family Physicians of Canada. Congratulations, Kathryn, on this well-deserved honor. For decades, you've been able to successfully bridge the gap between industry and academia to create continuing professional development programs that have had an impact on both physicians and their patients. Your belief in collaboration was instrumental in getting the Canadian Association of Continuing Health Education, CASH, off the ground, and your service on the board and executive were crucial to the association's success at that time. Enjoy the accolades and retirement. From Bob Chester, National Professional Education Manager at AstraZeneca Canada. I'm so pleased that you're being recognized for your years of dedication and contribution to CHE. Be they at Purdue or through CASH and RX&D, your long and distinguished career certainly qualifies you as a pioneer of CHE in the Canadian pharmaceutical industry. For over 25 years, I have sought your counsel, shared ideas, laughed and raged about CHE in Canada. Just because you retired does not let you off the hook. I do have your phone number and I will be calling. From Vivian Vinay, President, CME Solutions Canada. It is truly an honor to welcome you to the alumni of inductees of the Pharmaceutical Marketing Hall of Fame. Over the many years that we have collaborated, you have always been ahead of the CME curve with novel ideas to help optimize behavior change. Decades ago, we chatted about CASH and how an alliance of CME professionals could help drive the quality education we now enjoy in Canada. You've always embraced your profession with energy, strategic thinking, and creative approaches to each program. We are lucky to have shared the many changes in the CME landscape. Whatever the change, you always sought to exceed the new norm. I hope this moment becomes another life memory for you to treasure. From Alex Zooks, President, CPD Strategies. Kathryn and I collaborated on several milestone projects and innovations in CME. It was then I saw her true passion and lifelong dedication to professional development in action. I could always count on Kathryn to walk the talk of best CME practices in CME. Here are but a few of her countless collaborations with industry and academic medicine. Kathryn was the driving force in the successful creation of the Canadian Pain Coalition and the eventual launch of National Pain Awareness Week. Years after its formation, the coalition continues to keep pain management and palliative care on the federal healthcare agenda. Along with her colleagues in CME, Kathryn led the way with studies on measuring the impact of CME, the industry's holy grail, knowing what happens to knowledge levels, attitudes, and behavior after a study program. And of course, her involvement as one of the founding members of CASH. Even in retirement, I hope we've not heard the last from her. Quoting one of her close physician colleagues, Dr. Larry Liebrack, she once said to me, "Doctors can't practice what they don't know. What's more worthwhile than helping physicians help their patients?" And that's exactly what Kathryn did. Amazing testimonials, so now my turn. Since I've known Kathryn, she's overseen the development of countless educational initiatives, which were implemented hundreds of times, reaching well over 30,000 healthcare professionals. The programs she designed are renowned as credible, balanced, and some of the highest quality in the industry. They were always focused on improving patient outcomes. Kathryn was always excited to share her ideas. You've heard very innovative ideas. And a good number of times, those ideas were scribbled on the back of airplane napkins or random pieces of paper. And it was always very entertaining to watch her try and piece it all back together, and a lot of times decipher her own handwriting. Her leadership has led to a highly efficient and cohesive CHE team at Purdue. She always acknowledges and celebrates our successes, and on more than one occasion, we celebrated with our good friend, Kim Crawford. Always positive and optimistic, even when things didn't go so well. Her positivity was contagious, and she kept our team focused and engaged. Kathryn, you've been a wonderful leader and mentor and partner, but most of all, I'm privileged to call you my friend. Congratulations.
Well, I know it's getting late, but I do have a couple of things that I have prepared, short and sweet. Thank you, Susan, for your kind words. Also, thank you to the Chronicle companies for supporting these annual inductions. Like 3 or 4 of the other inductees today, when I first received the email from Mitch asking me to call him, I went to Susan, who knows him, and said, "What can this all be about?" And without hesitation, she said to me, "You're being inducted to the Hall of Fame, and it's about time." My first response was, no, this can't be true. However, when I called Mitch and I found out it was, I was flattered and humbled, especially when he explained to me both the nomination and the selection process. It is truly a long and supported process that they have. And quite frankly, if any of the 3 or 4 inductees that helped me get here today are in the room, I extend my heartfelt thanks to you for believing in me, for believing in what I have done for the industry, and especially for your belief in my nomination. In reviewing some of the 100 inductees, I see that, and as Susan has very kindly said, I'm one of a small group of people who have spent much of their careers either working in or working part of the time or full-time in education. As you can see from my profile, it's been almost 30 years that I have been working in education, and it has been my passion. Why is that? It really comes down to what many of you have said already, and it's about working with wonderful people, either on teams I have been a part of, working for superiors who supported education, as well as collaborating with wonderful and terrific healthcare professionals who developed the content of the programs that were designed, as many people have said today, for improving patients' health. And if any of you know me, and I know several of you have referenced this already today, I have always said, if we're not in the business of helping physicians, nurses, and pharmacists help their patients have better outcomes for whatever is going on in their lives, why are we doing it? This is why we're here. This is our passion, to help others help others. So in both being part of and leading CHE teams gave me the opportunity to learn with and learn from and mentor others in both the art and the science of healthcare education. It was most gratifying when I could see that one of my team members was making changes or applying themselves differently because of a mentorship discussion that they've had with me. It's always wonderful to see people being able to change after a discussion. I was most grateful, though, to the companies that I've worked for who supported and encouraged me to collaborate with experts to create unique and inventive programs with balanced content to be delivered by healthcare professionals to healthcare professionals who want to learn more about better assessing and managing their patients. And I'm grateful for several of my team members who I've worked with for many years at Purdue who actually came all the way from the other end of the city, all the way in Pickering, to be here with me today. I thank you for that. But most importantly is my association with other CHE professionals. These are the professionals who were my wonderful mentors over the years, and referenced by the, as Susan mentioned, the number of hours we spent discussing changes within colleges and how we might continue with our abilities to collaborate with wonderful physicians who, with their interest in understanding adult learning principles and how healthcare professionals learn, developed and also presented many programs we were able to support. I was most fortunate as well to be part of CASH, the Canadian Association of Continuing Health Education, for its 14 years, and for 6 years to be on the board. It is those mentors, they became mentors to me, is what helped me, and their passion helped to ensure the balanced education that we were able to support healthcare professionals in, and I will trust they will continue to do this in the future. I congratulate heartily the other inductees today who've been nominated and chosen for their qualities in leadership, their influence within the pharmaceutical industry, and their exhibition of high quality standards that the industry stands for. I'm flattered and humbled to be inducted today, and I thank you.